watching NBC 7 News at 6.
Tonight on the news at 6, we conclude our special series called Breakdown. Hello, I'm Mark Mullen.
I'm Catherine Garcia. Thanks for being with us. Well, we've been showing you why San Diego is facing a mental health care crisis and the many lives that's affecting. Tonight, in this final episode of Breakdown, we'll show you what's being done to try to help people. These are stories of hope. And we begin with a rare inside look at the special de-escalation training law enforcement officers all across this county are going through.
I don't need to go. I don't need to go. Can you take a report?
What you're seeing is training
I don't need to go to the hospital.
for what happens out on the street every day.
We're here to help you, but we need you to drop the bar first.
Officers training for a call involving a mental health issue. Calls they get more than 54,000 times a year. A man calls 911 because his delusional sister thinks drones are spying on her.
Stop right there. Now turn around for me, okay, real quick?
The San Diego District Attorney is spending $1.5 million for this round of training as part of a bigger effort to prevent what are sometimes tragic results.
The goal is to not wait for the crisis to happen, but to have systems that can properly and effectively and compassionately deal with it along the way.
The psychiatric emergency response team leads this training.
Wes Albers.
Wes is the PERT community liaison. He was a longtime sergeant and emergency negotiator with San Diego Police. He walked me through what this training is all about.
So we've got a couple sets here.
This simulator called the Milo Range Theater System is a big part of the training.
Anything that we go to, whether it's a traffic stop or you're going to something at a school or you're stopping by someone's house, virtually every call can really be the big one. But when you're dealing with somebody who's under the influence of certain drugs or they're in a crisis state because it's a mental health problem and they're intensely emotional or they're confused, they're disoriented, whatever is causing that problem, that doesn't fix generally with just a, hey, calm down, you're good.
He says it's all about active listening, empathy, making a connection, slowing things down.
The more tools we can give them to better manage, better slow down, better deal with it, the better outcomes we have. And some of those outcomes are the long-term health and welfare of the officers and the deputies as well. You know, they don't have to live with, what if I'd have just done that, you know?
So the hope is that training will prevent situations from escalating in the first place. But what if somebody does find themselves on the wrong side of the law because of a mental health crisis?
You shouldn't have to commit a felony or a misdemeanor to get help. You shouldn't have to. We're in Department 1203 of the San Diego Superior Court. This is a behavioral health court and mental health court, so we do everything related to mental health. My name is Cindy D. Davis. I'm a Superior Court with the state of California, San Diego County. The mission of behavioral health court is to take people that have serious mental illnesses and divert them from the prison system, from the jail system.
Here at Behavioral Health Court, they focus on people that have already entered pleas. But instead of putting these people behind bars, they live in group homes, they get their medication stabilized, they look for a job. And if after about 1.5 years they're successful, the judge can reduce or dismiss their charges. They graduate.
I'm going to start with Ms. Tamika Edwards.
It just feels so good that I finally did it. This program is wonderful. It helps you do that. And they give you all the steps. They give you all the necessities to where you can change your life. And that's what I did. I changed my life. And it's working out for me for the best.
Tamika Edwards worked really hard for this day. This is a high point for you. Where was the low point for you where you got that help you needed?
Actually, that's kind of touching. The best way I could tell you is I had a mental episode breakdown, and I ended up committing a crime and didn't even know it, and they put me in jail instead of the hospital. And come to find out, it was a harsh felony with a strike, a residential burglary. And I just was overwhelmed the whole time. I spent isolated in jail, and then my lawyer found this program for me and thought it would be best for me. It took me a while to get it, but I got it, and I'm here now. And I love every minute of it. Wouldn't change nothing for the world.
It took a lot of hard work, didn't it?
Yes, it did, ma'am. Yes.
This is what we should be doing with people. This is how we're going to rehabilitate people and actually solve problems long term, rather than just cycling them through over and over again in the criminal justice system.
There are other efforts underway to try and fix this breakdown in the mental health care system. In the North County, a pilot program's underway where people can call a crisis hotline instead of 911. If there's no threat of violence, a mobile crisis response team shows up instead of law enforcement. The hope is to expand that countywide. The county also wants to build 4 behavioral health hubs, places where people can finally go to get that consistent, comprehensive care they really need. The first one is set to be built right here on this site in Hillcrest. This is a rendering of what it might look like, but there's no date yet for when this project might be done, let alone any of the other hubs. The county also wants to build a pipeline of a lot more mental health care workers. That's a challenge because it's a career that is very stressful and often pays very little.
Mental health challenges and substance abuse have been rising, and it's now time we rise to meet this challenge.
It will be a long and expensive journey to actually make these things happen. Recovery on the individual level is also a long and difficult process.
My mother had passed away, and it was just really, I just couldn't keep it together for like I used to. You know, for whatever reason, it was just too much. I got to a certain age and I just couldn't do it anymore.
Lisa Garcia worked as a catering director, a single mom of 2 boys. When it all just became too much, she was in and out of the hospital, struggling with her mental health.
I was hopeless.
Her story sounds similar to others you might hear.
I never thought I would be well.
But this is the part you may not always hear.
And you got to a good place.
Very good place. I run a nonprofit organization, and I'm an advocate for people with mental health that you might feel helpless, but there are no hopeless cases, that you can get well. Well, humor's our best friend, temper's our worst enemy, yes.
Lisa is now a project manager for an organization called Recovery International. She invited us to this meeting before the pandemic forced them to meet virtually.
And if you can't change a situation, you need to change your attitude.
Good, yeah. Debbie?
The peer-led self-help model, founded by a neuropsychiatrist, uses a cognitive behavioral training system that helps people develop skills to lead more peaceful, productive lives.
The 2 things that have really resonated for me are, one, I first come to a meeting and I'm hearing people who are having the same struggles, and 2, I'm then given some tools to deal with those.
If we treated above the shoulders the same way we may have treated people below the shoulders when they're sick, you know, that would be my first thing. Be supportive, be kind, be loving. We didn't ask for this. I certainly wasn't the one that was asked. That I was the one in the family to have the illness.
Oh no!
Lauren and her son Jack also know it is not an easy journey.
Every single time we were let down by the system, and it's kind of a miracle that we've even made the progress that we've made in the last 8 years.
She's been struggling to get her son the mental health care he's needed since he was a little boy. But she wants people to know what they're going through because she says that is the only way we will finally see real change.
One thing, if you could get one thing out, what would you want people to know? I mean, the main thing that I want people to know is that that there are people out there who feel the same way you do, and that talking about it is the only way we're going to be able to do this together. There's no shame in having mental illness. There's absolutely no shame in having anything wrong with your brain. It's a part of your body. It's an organ just like everything else, and it needs just as much care as the rest of your body. And so you deserve it, and you should do everything you can to get it.
Lauren hopes that her family's story, all of these stories really that we've been able to tell, inspire people to push our community leaders for a real change in how we approach mental health care and a real change in how we think about all of the many people in our community who are too often struggling to get that care that they need.
Also, Catherine, I love all of the success stories because it shows what intervention can do, what is still possible. I mean, unfortunately, it seems that there is still some stigma associated with mental illness, which can only harm the people who really need the help. But I wonder, and maybe this is optimistic, but I wonder if during the coronavirus pandemic, when essentially everybody around the world has felt some level of anxiety and even depression, if there's more empathy to try and understand what is going on and perhaps move politicians to push policies that will benefit these folks further.
Yeah, I mean, certainly that would be a hope, right? I mean, if you just look at the numbers before the pandemic, we were looking at 1 in 5 people in any given year who would face some kind of mental health issue. Now, the most recent number being 1 in 3. I mean, think about that. These are our neighbors in our own families, the people that we work with, that we are walking by on the streets of our community every single day. So I think just based on the pure numbers, that might push the change a little bit quicker than perhaps it would have otherwise.
That would be great.
Yeah,
what a terrific series it's been. I know sometimes it's a tough subject, sometimes it's tough to watch, but so important and really uplifting at the same time. Great job.
Thanks. I do appreciate that. And I want to say thank you to all the people that did talk to us despite that stigma that remains, so that they, could hopefully see that goal of breaking the stigma and making some change. So big thank you to them. And we should mention, if you missed the last 2 episodes and for a guide of resources for those who may need help, just head to NBC7.com/breakdown.